Hello, my name is Blessing Raji, and I'm so excited sharing this leadership plan to reduce maternal mortality. Leading change in maternal mortality, a public health leadership plan to reduce maternal mortality. And I'm a student of Purdue Global University. The focus of discussion, I will begin my presentation with public health problems, why leadership matters, challenges being faced by public health leaders. Then we also want to talk on how contingency leadership can play out, public health leadership plan, and key stakeholders and collaborations, expected outcomes and recommendations. Then we'll have conclusion, references, and your feedback. Maternal mortality remains a major global health issue, and most of the maternal deaths are preventable. The leading cause of maternal deaths you have postpartum hemorrhage, hypertensive disorders, sepsis, obstructed labor. All of these causes are preventable. And according to WHO 2023 and Kasepwam et al. 2023. Why do we even think leadership matter in maternal health? Maternal mortality does not occur as a result of medical issue or medical causes alone. Instigating leadership or good leadership system will improve the health policy, resource allocation, healthcare workforce. The referral system also can be redesigned. Community education can take a good shape, and accountability or ownership can also increase. When all of these are being put under a good leadership, maternal mortality will definitely reduce. Now, there are challenges facing public health leaders that might obstruct the effort of public health leaders. Shortage of skilled birth attendants. In a community where the people lack skilled birth attendants, right? The leader might not be able to put into place strategies that can help reduce maternal mortality. But when skilled birth attendants are available, or a situation whereby some nurses do not even want to work at the low level or the community level, they prefer to stay at the urban settings. This can be a challenge to the public health leaders. But when we have a situation whereby skilled birth attendants, nurses, midwives are able to, they are able to be deployed into the communities or rural areas, then this might not be a challenge to the public health leaders. Poor infrastructure. A primary health center that does not really have good infrastructures might not be able to perform well, and this can be a challenge to the public health leaders. Inadequate funding. There has been a huge gap in the funding system that has affected the primary health centers. So when there is inadequate funding, where a leader is seeing a need for a project, either community projects or primary health care projects, and the policy or the government is not responding, this could be or can lead to a challenge, right? And can obstruct the growth of maternal health. Cultural beliefs. When a leader does not really have high cultural knowledge, there might be a challenge in trying to instigate evidence-based practices into the people's culture. So a good leader, a public health leader, must ensure that he or she is culturally equipped or knowledgeable, know the people's norms, practices, right? Else, this will be a challenge to the public health leaders. Transportation barriers, either to the public health leaders, right, or to the woman herself, then this can also affect maternal health. Weak referral systems. We've had cases whereby women died as a result of slow or weak referral system. So when this is being put in place, then the challenges might be reduced. Else, this challenge can also affect the public health leadership system. Health misinformation. We are now in the era where technology has taken a whole lot of of us, and we have a lot of people who are not medically sound or medical experts, but they give health information, and this health information mostly misinformed. So when the output or this challenge is greater than what the public health leaders can face, then there will be a low turnout. Poverty. Poverty is one of the factors that can affect both the public health leaders and also women who need the support. Now, how do we apply contingency leadership? For contingency leadership, it's a leadership style or approach whereby a leader tends to solve problems or situations differently with different approach. It means that there is no one size fits all, approach. For example, during obstetric emergencies, it can be or it could be a form of directive leadership where the leader, show up by himself. During engagement, community engagement, it could be a participative leadership role that will be seen. Training nurses or healthcare workers comes in as a result of coaching leadership style. And for policy advocacy, we can also have it to be transformational leadership. Then for a situation whereby there is resource shortages, a leadership style could adopt collaborative effort or collaborative leadership. So it's not a one strategy fits into all, it's different strategies for different cases. So now for leadership plan, I will is to improve maternal health outcomes through coaching sessions. And the objective of this is number one, increase antenatal attendance. For antenatal attendance, a lot of women do not start at antenatal as soon as possible or during the first trimester. Some women tend to wait till the third trimester or even still give birth at home. So having a coaching session, health coaching session integrated into the system will improve ANC attendance. And this in among women who I have had coaching session with, the attendance has improved to about 98%. So now also it will increase skilled birth attendance because more skilled birth hands will be employed or deployed into the communities. Postnatal care. Women usually suffer a lot after delivery, or many care end at delivery. But having coaching sessions integrated into into the maternal care would increase postnatal care or improve postnatal care. Emergency referrals also will be strengthened. Where coaching sessions, where coaches become the intermediary between the system, the facility, and the people, right? Emergency referrals become improved. Community awareness. Coaches or community health workers can also help in creating more awareness within the communities. So what strategies are we looking at? We are looking at equipping the people with community education. In my years of practice, especially as a health coach, I've seen that community education or health education play a vital role in helping people adopt change. So introducing community health education would definitely improve maternal health outcomes. Mobile clinics, making it easier for the women to reach the community or to reach the people, right? Taking health from the higher level to the grassroots would also help improve maternal health outcomes. Community health workers training, right? Training health workers or the community, people who can meet the women at the community base, the community health workers training would also improve. It's one of the strategies that we're looking at. Emergency transport or either transport fare or transport system can be put in place. Digital health reminders. Yeah, I remember that in all cases, we usually send reminders to the women, and also the use of technology can help, prompt reminders to the women. Quality improvements. Having all of these strategies in place will improve the quality of maternal health. Now, what are the stakeholders? For us to ensure a good outcome from the maternal health, from maternal health, there has to be government involved. So hospitals have to be involved. Primary health center, midwives, nurses, right? The medical team in general. Traditional birth attendants will also be involved because a lot of these women tend to trust traditional birth attendants more, and all efforts trying to reduce their participation might not really come so quick. So it's important that they are also partners, and we equip the traditional birth attendants to ensure they can be able to identify red flags, right, or high-risk pregnancies or cases that can also improve the referral system back to the hospital. Community leaders also are people to work with because the people belong to families and different groups. So having community leaders come in place, right, or partnering with them would also ensure improved maternal mortality, improved maternal health. Religious leaders, women tend to trust their the pastors, imams, their lead religious leaders. So keeping them also to understand the importance of evidence-based practices, quick referrals, in identifying emergency cases would also improve maternal health. NGOs can come into, will definitely be needed. WHO, families, and the woman herself or the women can also be equipped. They are also part of the stakeholders. Expected outcomes for this approach is to have reduced maternal mortality, early antenatal care booking, improved care, skilled birth attendants, improved referrals, better collaboration, improved patient satisfaction, healthy equity, right? Improved infant care also can are the outcomes that we're looking at. In conclusion, maternal health is preventable once we have effective leadership style or leadership style in place where a leader does not have to focus on a particular style or solution, provide a solution for all systems. This leadership style can be so flexible and fit into different situations at different style. And also a situation whereby community health, public health leadership can also collaborate with other health providers. This can help improve sustainable outcome in maternal health. We need to invest strengthening the families, the communities, the health systems with health education, right? The right knowledge needed to ensure that women have access to community quality maternal health. Together, I believe that we can prevent and reduce maternal death or maternal mortality and promote equity, high quality maternal care among the people. Thank you. And then we have the reference. Thank you. Waiting for feedback, questions, and answers. Thank you.